Chair, I've got apologies from Councillor Evans.
Okay. Right. Declarations of interest. Anybody to declare, please? No? Okay. Minutes of the meeting held on the 7th of December. You've all had copies of those. Anything that, in terms of correctness or concerns, please shout now, forever hold your peace. Moving on to item 5 then, matters referred, recommendation of Cabinet. You've also had copies of that. No comments or concerns about that. Then moving on to item 6, the forward plan. Lucy.
In terms of items referred, I think you're talking about the local plan. That was the item referred, wasn't it? Sorry, I'm struggling a bit with my paper.
Which item are you referring to, please, Lucy?
The items referred.
Items referred, okay. Matters referred, is that?
Matters referred, which is the preparing a new local plan for Derby.
Yeah, item 5, okay.
It's just, we saw this as part of the Cabinet agenda as it came past us previously. But looking at the hope here to engage with councillors as part of the development process for this, I was hoping that we could also do more than previously and more than probably statutorily required to engage with the wider population in Derby, because we know as councillors that people often complain to us about planning issues which we can't do anything about because of our local plan. And I think that if we are able to engage more with the public earlier, we might get a greater understanding of the process, which would help us in the future. So there's nothing specific, unless we wanted to put something back, I think, at this point, to ask Cabinet to look further into this, which might include things like doing some more work online to invite people to online meetings. We were invited. So it's, and how we can explore greater engagement, particularly in COVID times when we may not want to have the exhibitions that we might have had in the past.
What I'll do is I'll ask Paul Clark, Head of Planning, who's with us, for his comments, and then if you want to make a recommendation, then please come back. Paul, could you help us, please?
Thank you, Chair. I think it's a really good idea to bring planning and planning consultation up into the 21st century, making it as encompassing as we can. And what I need to do is draw up a terms of reference for this group, which this can be part of it, and take that forward. So when we get the group set up, we have it in the terms of reference that we will be doing this engagement as well going forwards over the next 2 years. Thank you, Chair.
I'd welcome that, and I think it's quite appropriate for ourselves as councillors to be leading on that community engagement, and we can explore how to do that further alongside planning and planning officers. Thank you.
Thank you, Lucy. Okay.
Chair, I think Alex has indicated.
Yeah. Alex, should come in?
Yeah, Chair, just to clarify, obviously this is a minute extract from the Council Cabinet meeting, and Council Cabinet are asking the Executive Scrutiny Board to establish this cross-party working group. So obviously, if you are in support of the principle of establishing that cross-party working group, you'll need to agree the minute, and then obviously, as Paul has suggested, he can come back with some draft terms of reference and work up the detail on that proposal. But if you are in agreement with the principle of a cross-party working group reporting into the Executive Scrutiny Board to take forward the development of the local plan, then that needs to be agreed here and now.
Thank you. Okay, that was item 5. Item 6, forward plan.
Chair, do we formally need to take a vote on that?
Yeah. Do you want to propose it then, Lucy? Yep.
Yes, I propose that.
Okay. All those in favour, please show. Those against, please show. I think that's passed. Okay, thank you. Right, forward plan, item 6. Any issues or concerns? Please don't wait until we get onto item 8 to say, can I go back to item 6? Because I won't be best pleased. Okay. No, nothing on a forward plan. Right. Item 7, Council Cabinet responses to scrutiny recommendations. You've got the copies of that. Item 7. No? Okay. Item 8, performance plan. Any comments?
Chair, if I may, just briefly to add that the only thing I wanted to report here is that my next step is to send the minute extract from the last meeting with the report to each of the individual scrutiny boards for them to consider the proposals under their standing work programme items.
That's great. Thank you for that, Stephen, for that clarification. Okay. Right. In terms of executive scrutiny, we're now moving on to the Cabinet papers. And first item, I'll take the late item, and that is on Community Vaccination Champion Programme. Have we got Robin here, or Andy, are you going to speak to this? Okay, thank you, Andy.
Thanks, Martin. So this is a report that's been prepared by Public Health, and it's to seek approval from Cabinet to receive funding from the Department for Levelling Up Housing and Communities of just short of 500 million from the Community Vaccine Champions Programme. Sorry, £500,000. I'll get my sums right. Sorry, £500,000 from the Community Vaccine Champions Programme, and this funding became available, as I understand it, just before Christmas. So we had to submit our bids very quickly, but it's essentially to promote vaccine take-up amongst hard-to-reach communities in local authorities where there are low levels of COVID-19 vaccination uptake. So it's simply to ask Cabinet to receive the funding and then for the Director of Public Health to dispatch the funding in line with the guidance. Thank you. Thank
you, Andy. Comments, please. Lucy.
Simply that I can't actually see a copy of this online. Is it available on the system?
Andy, can you help us with this? Is it online?
Am I?
So Stephen, yep.
It has, Karen has uploaded it at the bottom of the Cabinet agenda. It should appear there. I've just updated. Maybe it came in while I was on my way here. Yeah, thank you.
Okay, anybody else want to comment? Do you want to, other issues there, Lucy, you want to quickly scan and then come back to us on?
From the introduction, Chair, it would seem to be fairly routine and straightforward, though the details of the project will be interesting. I think, Chair, my only comment would be that this is another example of where we are wanting to engage with the public, and there's nothing in the bullet points here that would say that there's a role for councillors within this. They're talking about faith, sporting, celebratory events, co-production and messaging, but nothing about councillors' role in this. And it might just be something they might consider.
Hardil.
Yeah, I mean, any opportunity to get additional funding to promote take-up of the vaccination is going to be a good thing. And if this is about supporting the recommendation to access funding, which is it £485,000, would be welcome. I certainly can say that from representing Normanton Ward, that any way we can actually maximise, although the take-up has been not bad. I mean, I think a lot of the communities have been really well, but it's well known that deprived urban communities are less likely to take up vaccination, and any opportunity we can get to access funding for Derby City to improve take-up has got to be a good thing. So, I'd be very supportive of this, and hopefully we can get the maximum amount. hopefully all £485,000 worth.
Absolutely, Hardy. I'm sure we're all in agreement. For me, I can't think why anybody would not support this in terms of, because we do know there's certain parts of all in cities that are hard to get to, and these extra resources hopefully will be the key to that. So if there's no more comments or observations, then we'll move on from that. Thank you, Andy. Okay. Item 7, recommendations from the Executive Scrutiny Board.
Sorry, Chair, just one thing. Just for officers, really, because the last but one briefing we had as local councillors, there was talk about certain areas not having good take-up. And a lot of us put ourselves forward to help with that and get the message out. That doesn't seem to have happened. This was just before Christmas. So anything we can do now, but also in terms of this funding and being champions, in addition to anybody else, we'll be very pleased to do that. And so if that can be taken into account for this application, but also previously when we did ask for information at our local neighbourhoods so that we can actually help champion this now, never mind when this funding comes along.
I can see Andy's obviously nodding to that because, again, I think that's a given that local councillors will and should be involved, because that's going to help make sure that this money does exactly what we all want it to do. But it's important that local people on the ground are involved. You're absolutely right to raise it. Andy's got that, and we'll take that up. Thank you very much. Okay. Right. Lucy.
Just that point from Hardiel is that he raised it last year and nothing has happened. You've not been contacted since. You're a key person who should have been contacted. It clearly isn't something that is currently happening. It probably is something that we should put a recommendation in just to put it there, clearly mark it. Do you agree with that?
I mean, I don't want to be facetious. Last year was only 10 days ago. But Andy has got. But if you want it underlined by putting a recommendation, please do. I think Andy's got it on board. But if you feel more comfortable by making a recommendation, can you get that done now, please?
I mean, I think if I'm happy to propose this, it's really re-emphasising, reminding that at the last but one briefing for councillors on vaccination take-up, there was information which said that certain areas or certain neighbourhoods were less likely to take it up. And I think this Executive Scrutiny Board should recommend to Cabinet for the relevant officers to pick this up and actually use local councillors, whenever the take-up is low, to be the champions and to do this urgently, because that was actioned at the last but one briefing for councillors.
May I suggest some words?
Yeah, go on, Lucy.
To ask Cabinet to ensure that local councillors are included as part of the work to encourage individuals, especially within hard-to-reach communities, to engage with the COVID vaccination programme.
Okay. Yeah. Okay. Do you want that sent to you, Stephen? Yeah. If you could send that, just ping that to Stephen, would you mind, Lucy? Yeah. If you could do that, that's gone. Yeah, Stephen.
Chair, just quickly, I'm taking it that there is. I'm taking it we're all in agreement. Members are all in agreement with this.
Yeah. I was just going to go to that.
Great.
Is anybody that disagrees with that? No, I think we're generally in favour. I'm sure we are in greater engagement to make sure that's actually formally recognised. Okay, no dissent from that. So yeah, we'll go ahead with that. Thank you for that. Right. Can we move on, please? Item 7, recommendations from the Executive Scrutiny Board. You've always had copies of those. That's pretty uncontentious, hopefully. Nobody's shouting out otherwise. So item 8, highways maintenance progress on the £9 million investment. That's from the Community Scrutiny Board. Who wishes to speak to this? Any particular officer or member? Alex.
Chair, just to clarify, this is a recommendation to Cabinet from another scrutiny board. Now, obviously, you're welcome as a committee to comment on it, but they're making recommendations to Cabinet in the same capacity that you would as the executive board.
Which I'm inviting now members to do. Any comments to make about those recommendations? If not, Lucy.
Chair, the only thing I would suggest is that we might want to endorse recommendation 3, which is asking Cabinet to write to the government. Just for it to be minuted that Exec Scrutiny endorses the recommendation from that commission. I was quite interested in this, Chair, because there were questions asked about, for example, which areas of the city there is particular pressure on places. And that is something which doesn't seem to be clearly answered within the minutes from that meeting. And it's something that would have implications for planning, and both planning, development control, and also future planning.
Are you saying the minutes are wrong, Lucy? Or
No,
need
Chair,
amending?
because I wasn't at the meeting,
okay.
so I just say that the minutes don't include that information. That information may not have been provided. But I think it is a significant question to have asked. And I think it's something where we know that there is already work done between planning and education in terms of the place planning. But the point raised here in terms of accessibility of schools for non-motorised modes doesn't seem to be something that's been engaged with as much within the planning system as it maybe Scrutiny was asking for. So I think it's the points that I would think I'd like to emphasise is not just the need for secondary normal area review, but also to ensure that our primary local areas are accessible, and working even more closely with planning to achieve that.
Okay, so would you like to add anything to that, or make a recommendation, Lucy, or are you just wanting something to be noted?
What does anybody else feel about that? I think we'll just note it then, Chair.
Thanks, Martin. So this report is recommending, or will recommend to Cabinet, that Derby City Council should be a signatory to a Derby and Derbyshire Anchor Charter, which is attached to the report as Appendix 1. Anchor institutions are those large organisations and businesses that are essentially anchored or rooted in a place or community and are likely to relocate. Anchor institutions have sizable assets that can be used to build wealth in and help develop local communities through things such as procurement, workforce, employability, buildings and land, etc. The Anchor institution's work in Derby and Derbyshire is being led by Joined Up Care Derbyshire, which is essentially the integrated care system as we move forward. So all the health organisations and city and county councils coming together. And Joined Up Care Derbyshire has set up a group which has senior leaders from the key Anchor institutions across the city and the county, including both councils, all the NHS organisations, the university, Rolls-Royce and Derby County Community Trust. And the group is co-chaired by myself and the Chief Executive of Derbyshire Healthcare NHS Foundation Trust, Ifti Majid. This is the first time that organisations have come together in this way and agreed to develop an Anchor Charter, which sets out fairly strategically to secure a commitment and to provide a strategic framework for how the major institutions will work together to benefit communities from across Derby and Derbyshire. The initial focus is on workforce and employability, and all Anchor institutions have carried out a stock take of what is currently delivered and has provided an overview of good practice, opportunities for sharing and or scalability. So each Anchor organisation has agreed to take the Charter through their internal governance process to sign off, hence why it's going to Cabinet. Thank you, Chair.
Thank you, Andy. Any comments or observations from members? Hardiel.
Yeah, Chair, the only comment I had is that there's some priorities on page 5, I think, which says two of the impact areas have been adopted so far, not the others, which is workforce and access to work and procurement, but not so far partnership, place, neighbourhoods and local communities, buildings and in the environment. Is there any reason for that, Andy? Why only two have been adopted at this stage?
Andy?
Yeah, thanks, Hardle. The decision of the anchor group was to try and start with one or two priorities rather than to try and boil the ocean all at once. And the rationale behind particularly the workforce and access to work was really a reflection on some of the scarring that we're seeing in communities as we emerge out of COVID. And it felt as if some of the discussions that we had, that both how anchors operate as employers for our own staff, as well as how we try and develop opportunities for getting people into work, seem to be seem to have resonance really with all the anchors around the table. And then the procurement aspect has been around the kind of social value in procurement in terms of how effective organisations are and really trying to think about the social value as we develop procurement exercises. And there's some really good examples across the system, but there's also probably more we can do. So I think it will be iterative and it will develop and this will evolve, I think, as priorities emerge. But I just think the conversations that we're having as a group of anchors around the table are really helpful, actually, and it's the first time we've got together in that space. I hope that helps.
Thanks, Andy. That was mentioned. Lucy?
I was interested to know how this particular selection of organisations was included, whether there's been a sort of expectation of a break point in terms of organisational size. There are other educational establishments who haven't been included. We haven't got the fire and police there, as far as I know. And the other question is how this is reporting to the general public, back to us, to its members, there's talk about listening to diverse communities, but it's not clear as to how that's likely to be happening. So just a bit more, is there a bit more somewhere about how it's actually expected to work and what the feedback mechanism is? How do we judge whether it's successful?
And if you could help us, Andy, about feedback, accountability. Okay, thank you.
Yeah, great questions, Lucy. I think in terms of which anchors are around the table at this particular point in time, I agree. I think that we have started off with what you could arguably say are the obvious major anchors across Derby and Derbyshire, so the councils, the NHS in its broadest sense, and that's both the providers and the acute trusts as well. We've incorporated the university and we've gone to and looked at Rolls-Royce, but I think our view is that this will be iterative. So for example, I know that there are discussions taking place with some of the districts in the county who are interested in the work and also potentially with Toyota. So I think it will develop as we go forward. The idea or the issue around communication and how we actually try and tell the story, I think, is one of the aspects of the work that we're looking at in the group. So we've agreed that communications is going to be really key here. We have got some capacity to assist with this through Joined Up Care Derbyshire, who have got a comms team and a comms lead, a comms director, who's going to work with the anchor group in how we try and get some of the case studies, really, some of the stories out there around what difference this is making to people's lives. Because when we look at some of the good practice that takes place in some of the other anchor or some of the other systems that have a little bit further forward with the anchor charter and the way of working, what tends to bring to life some of the impact is around some of the case studies that they tell around the way in which they may have changed how they do procurement or how they've developed particular pipelines to get people into work. So we're going to develop that, and that will clearly need to be cascaded in a range of different ways to communities, to councillors, to employers that work within the anchor organisation. In terms of the how we know we know what we're doing and so on, we've been really, it's an interesting one because this is not a group that we'll be developing a formal set of performance indicators or have a RAG rating set of KPIs and such like. It's very much about how do we, as a group of anchors, with those kind of agreed strategic priorities, hold each other to account really for how we change our behaviour and change our practice within organisations based on the principles, and then hold each other to account really through updating our position around what difference we're making and stock taking against the recommendations and priorities that we've agreed, so that we are demonstrating through case studies and through people's lived experience what difference we are making. So we're currently at the moment, as we speak, ahead of a workshop at the end of this month, doing a stock take on the first 9 months of the work to see what difference we've done in the context of employability, workforce and procurement. But the main focus so far has been on the workforce and employability. Thanks, Lucy.
Thank you, Andy, for that clarification, explanation. Okay. Lucy.
Chair, this sounds to me a bit like another opportunity for a similar group of people to be meeting and talking, as we've had before with organisations such as the Renaissance Board and the other sort of city partnership boards. How are we in danger of having more meetings and not actually different outcomes? Are there things that should be laid down by when we're picking up something like this?
Yeah, we did raise this with a pre-meeting with Andy, and he offered a very adequate, eloquent explanation, but I forgot what it is. Andy, please remind us. Thank you.
I need to remember now. I can see Alison looking at me as well, thinking, is he going to remember that? I think that's a really good point, and I think that the key thing for the group that I'm involved in the anchor space is trying to ensure that we're not duplicating efforts, because there are conversations taking place in a range of different spaces around, particularly things to do with employability and workforce. I think that what we haven't necessarily got is a conversation that's taking place with all of the main anchors at the same time in a defined space with a set of strategic priorities around, in this space, workforce, employability and procurement. And I think that it's about how we try and ensure that we are not duplicating what's going on elsewhere. But part of the work we did in the first 3 months of developing this was to try and map out what already is existing across this space, because it is quite a busy space, to look at where we think we can genuinely add value. And actually, what I was quite surprised about is that there isn't a lot of sharing of good practice that goes on around some of our practices, around how we look after our own staff, but also some of the things that we've done to try and get people from communities into work. You'd think there might be, but there are some gaps there that I hope will add value. But I agree, it needs to be a group that makes some impact. It isn't just a talking shop. So I do agree, and I do take on that challenge, as we all do in the group. Martin, Lucy.
I think it was as eloquent as the first time round. Thank you, Andy. Are you okay with that, Lucy?
Chair, I think from that, it may be that we should be asking that there is a reporting process, and Cabinet consider what reporting process should be included as part of this new structure.
A reporting process, okay.
Yeah. Do you want me to type something, or?
Yeah.
Or just think about it.
Okay.
We ask that Cabinet consider what sort of reporting process should be included as part of the organisation of this.
So Cabinet considers what an appropriate feedback
an appropriate reporting process.
Reporting process
to key stakeholders.
Okay.
As part of this new organisation or this new structure.
Okay. I'm sure, I would hope that they would accept that, Lucy. I think that's a reasonable suggestion. Have you managed to capture that, Stephen?
Yep, Chair. So just quickly, if I can lean over here. Right. Yeah, so it's basically for the Council Cabinet to consider what sort of appropriate reporting process to use to key stakeholders as part of this new organisation.
Okay, that seems very reasonable. Okay, everybody happy with that, or any concerns of that? But I think people are generally in agreement with that, Lucy and Stephen. Yep, we're okay with that. Thank you very much. Thank you, Andy. Okay, item 11. Council tax base. Simon, over to you.
Thank you, Chair. This is an annual report which you receive and make a recommendation to Council, and that's scheduled for next week's Council meeting on the 19th of January. So the Council tax base counts the number of properties that need to go on the Council tax register, applies any reliefs and any discounts to that to come up with a figure which is known as a Band D equivalent figure, which the council tax is then multiplied by to give the yield in the medium-term financial plan. You can see there that the proposed council tax base is 70,030.60 compared to last year of 69,545. What that shows is an increase of just over or just around 500 properties, but the report details that the increase is actually more than that. There's been about 800 properties brought onto the council tax register, but we've had to discount it by a lower collection rate as we come out of COVID, which the report talks about being 97%. So the net impact of that reduction in collection rate as we reflect the collection that we can achieve post-COVID was an impact of about £500,000 in the medium-term financial plan, and approximately 300 properties not being calculated into the Band D equivalent. So that's the first part of the report, which is to agree with council tax base. The second recommendation is to approve from April a council tax empty property premium is not charged for 12 months on change of ownership on properties that are being continuously unoccupied and substantially unfurnished for a period of at least 5 years. This is primarily to help move those more stubborn empty properties which have a premium charged, and you'll see in the report it talks about the different bandings for a premium, in order that if someone was to then acquire that property, they don't then get penalised by having to pay a premium as they're trying to bring that back into use, in terms of taking away the blight of empty homes and also providing much needed housing in the city. So just for context, currently we have 224 properties charged 100% premium, 66 properties charged a 200% premium, and 20 properties charged a 300% premium. So this change is really at that lower end of the 20 properties, and I'm sure most of you as ward councillors will hopefully support that if there is an opportunity on change of ownership to encourage people to bring it back into use without having to pay a prohibitive premium. It will be good for the city, it will be good for the environment, and it will be good for meeting our housing needs in the city. Thank you, Chair.
Thank you, Simon. Comments and observations apart from Lucy? I'll just see if there's anybody else first before they... Lucy, over to you.
Thank you. My first question was the numbers of properties in empty properties premium, so thanks for that. But could you explain how whether these are included as part of the tax base?
In calculating the tax base, you do, if you want to call it a head count of the properties, and then it's factored in by any reliefs or premiums that we charge. So you add in if it's a premium, if it's a single person discount, if it's a other type of relief like a Band A exemption or whatever, you discount it, and you also discount it by the number of council tax or local council tax support claimants that we anticipate will apply for the forthcoming financial year. So you put it all into the sausage machine and it calculates a net figure at the bottom of the number of properties that we then translate into what is called a Band D equivalent, which is a national indicator that council tax is calculated on. Thank you.
Thanks, Simon. Lucy?
Thank you. It was particularly the empty properties premium and whether that was factored in as well. A question which may not come directly from yourself, but may need to refer elsewhere, which is how are we actually identifying that properties are empty and should be charged the additional premium? And is there more work to be done on that?
Right, it's quite useful that I've got both the head of planning and the head of housing here, but within my service we have a series of property inspectors, and if you think about your caseload, you'll have caseload about empty properties, properties having major repairs done and everything else, and people can come to us saying, this is the stage of my property, and then of course we'll follow that up to identify when it comes in. Maybe just approaching Ian or Paul, they might be able to talk about how we identify as part of our empty home strategy and approach, and encourage, if you want to call it, which we do encourage people to bring these houses back into use. So Ian?
Ian?
Yeah, thank you, Chair. Yeah, so we obviously respond to complaints to identify empty properties largely, and indeed or every property that we take ultimate enforcement action against will have been subject to a complaint from neighbours or a ward councillor and the like. But we also do work off council takes lists as well to identify those properties that are empty. And first of all, as I've said to members many times before, it's very much our approach is one of support and encouragement to encourage owners to bring these properties back into use. And it's only when that has repeatedly failed for at least a year, normally 18 months, 2 years, when we then start to take the harder line and start talking about CPOs.
Thank you. Okay. Right, there's no more contributions on that. Thank you, Simon, for that. Moving on to item 12. This is the authorisation to bid for Homes England Affordable Homes Programme 2021-26 grant funding. Thank you.
Thank you, Chair. So members will be well aware of the Council's ambitions to increase both the scale and the pace that we build more affordable housing within the city. And members will also be familiar that the council has to sell its own council stock through the right to buy process, and typically before COVID, our sales through the right to buy was running at about 160, 170 properties a year, and obviously the sale of those properties generates a receipt that in the first instance comes to the council. Under government rules, the council used to have just 3 years to spend those receipts on new affordable housing, and if we didn't do that, that money or those unspent receipts would go back to government. And like lots of councils, it was always quite a challenge for us to keep ahead of the spending profile to ensure that we didn't have to hand money back to the government, and indeed many councils started to hand large sums of money back to the government. However, last year the government changed the rules and have given councils 5 years now to spend those receipts. Well, that's given us the breathing space now to change our strategy. The previous strategy was one where we would buy a lot of houses on the open market because that's a very quick way of spending the money to avoid handing it back to government. Now we can take a slightly longer term view, which means moving the strategy to new build, which offers advantages in terms of it's more cost efficient for the council and